What if one small thing you do every night before going to bed is quietly putting your heart in danger? What if this thing feels completely harmless? What if millions of people over the age of 55 are doing it right now, tonight, without having any idea what it is doing to their heart while they sleep? That is not a question asked to frighten anyone. It is asked because the answer matters deeply. And the answer could be the difference between waking up tomorrow morning feeling fine or not waking up at all. The nighttime mistakes that are most dangerous are always the ones that feel the most normal. This is not about extreme cases or people who are already very sick. This is about ordinary men and women who go to bed every night feeling reasonably okay. People who have manageable blood pressure. People who take their medications. People who think that because they wake up each morning, the night was safe. But the truth is, the heart faces some of its greatest stress not during the day, but during the hours of sleep, and certain small habits, each one looking completely innocent on its own, can combine during the night to create serious, life-threatening pressure on the heart. Before going any further, there is someone whose work must be acknowledged. Her name is Dr. Patricia Monroe. She is a widely respected cardiovascular health researcher who has spent over 30 years studying heart disease in people over 55. She has published research, worked with cardiologists across the country, and dedicated her career to one central mission. That mission is helping older adults understand the hidden risks that doctors do not always have time to explain during a routine appointment. She is known for saying that most heart events do not happen because of one big crisis. They happen because of many small, ignored habits that build up silently over time. Dr. Monroe has spent years reviewing cases where people appeared healthy but experienced sudden cardiac events during sleep. Her findings have changed the way many doctors think about nighttime heart health. And what she shares with seniors is not complicated. It is practical. It is clear, and it is the kind of information that stays with a person because it makes sense in a way that academic language never could. What follows today is drawn directly from her research and from the patterns she has observed in thousands of patients. Please read every word, because this may be the most important health information received in a very long time. There is a story that Dr. Monroe shares often. She shares it because it is true and because it represents something she has seen repeated too many times. There was a man in his late 60s. He lived a fairly normal life. He was not obese. He was not a smoker. His blood pressure was slightly elevated but manageable with medication. His cholesterol was within acceptable range. He went for a routine checkup, and his doctor told him he was doing reasonably well for his age. He mentioned that his sleep was not great. He said he woke up tired most mornings. His doctor told him that was normal for a man his age and moved on to the next topic. 2 weeks after that checkup, the man died in his sleep. His wife said there was no dramatic event beforehand, no sudden pain, no alarming symptoms the night it happened. She said he had come to bed complaining that he felt tired. That was it, just tired. And by morning, he was gone. His death was ruled a cardiac event during sleep. His wife later told Dr. Monroe that she had noticed him snoring heavily for years. She had noticed him waking up gasping for air occasionally. She thought it was just the way he slept. Nobody told her those things were warning signs. Nobody connected those nighttime habits to the heart. And that is the tragedy that Dr. Monroe works every single day to prevent. This story is not shared to cause fear. It is shared to create awareness. Because the things that man was doing and the things his wife was observing are the same things happening in homes all across the country every single night. People normalize them. Doctors sometimes miss them. And the heart quietly pays the price. The truth is that sleep is not simply a time of rest for the heart. During sleep, the body goes through dramatic internal changes. Blood pressure shifts, breathing patterns change, oxygen levels fluctuate, the circulation slows, the heart rate drops. These changes are normal and healthy when the body is in good condition and the nighttime environment is supportive. But when certain habits interfere with these changes, the heart is pushed into a danger zone that most people never even know exists. Now it is time to talk about these habits specifically. There are 5 of them, each one is common. Each one is something that millions of people do without a second thought. But each one places a measurable burden on the heart during sleep. The first mistake, and one of the most widespread, is going to bed dehydrated. This sounds simple. It sounds like a minor thing. But inside the body, dehydration at night sets off a chain reaction that the heart struggles to manage. When the body does not have enough water, the blood becomes thicker. Thicker blood is harder to move through the arteries and veins. The heart has to work harder to push it. The circulation slows, and in that slowed state, the risk of blood clots forming increases significantly. There is a specific time window during the night when this danger peaks. It is between 2 in the morning and 6 in the morning. During this window, the heart rate is at its absolute lowest. The body is in its deepest state of rest. And if the blood is thick and the circulation is sluggish during those hours, the conditions for a heart attack or stroke become far more serious than at any other time of day. The reason so many people go to bed dehydrated is understandable. They are trying to avoid getting up in the middle of the night to use the bathroom. It is a completely reasonable goal. Nobody wants to wake up at 3 in the morning. But cutting out all fluid before bed to achieve that goal is trading a small inconvenience for a significant heart risk. The correct approach is not to stop drinking fluids entirely. It is to drink a small, moderate amount of water about 30 to 60 minutes before going to bed. Half a glass is enough. It keeps the blood at a healthy flow consistency without overloading the bladder. It is a simple adjustment, but it supports the heart through the most vulnerable hours of the night. The second mistake is sleeping completely flat. This is one that many people have never even considered as a health issue. It just feels like normal sleep. But for many people over 55, lying perfectly flat on their back causes a physical redistribution of fluid in the body. When the body is horizontal, fluid from the lower extremities moves upward toward the chest. This fluid increase raises the pressure around the lungs and the heart. For people who have any degree of cardiovascular weakness, even mild, this extra pressure can cause real strain through the night. The signs that this is happening are often dismissed or explained away. Waking up in the middle of the night with shortness of breath, needing to sleep with 2 or 3 pillows propped up just to feel comfortable, feeling significantly better after sitting up for a few minutes compared to lying flat. These are not random complaints. They are the body communicating that the heart and lungs are under pressure from the sleeping position. Many people think these feelings are just part of getting older. They are not. They are signals that deserve attention and a simple solution. The solution is to elevate the upper body slightly while sleeping. This does not require a special bed or expensive equipment. A wedge pillow placed under the shoulders and upper back achieves this well. Even elevating the head of the mattress by a small amount can make a meaningful difference. When the upper body is raised slightly, fluid does not pool as heavily around the heart and lungs. Breathing becomes easier. The heart faces less pressure. Sleep becomes deeper and more continuous. This small positional change has helped many seniors wake up feeling significantly more rested and less short of breath. The third mistake is taking the wrong sleep aid before bed. This is one of the most dangerous mistakes on this list because it is done with good intentions. People want to sleep better. They take something to help. And they trust that if it is available over the counter or widely used, it must be safe. But many common sleep aids carry hidden risks for the heart that most people are never warned about. Some of these medications interfere with breathing during sleep. Some lower oxygen levels. Some disrupt the normal rhythm of the heart during the night. And for people who already have any underlying heart or breathing issues, even ones that have not been diagnosed, these medications can push the body into genuine danger. There is a group of people for whom this risk is especially high. These are people who snore loudly and regularly. People who sometimes stop breathing for a few seconds during sleep, which a partner might have noticed. People who sleep for 7 or 8 hours and still wake up exhausted. People who feel groggy and unrefreshed no matter how long they sleep. These are signs of a condition called sleep apnea, and it is far more common after age 55 than most people realize. Taking a sleep aid without knowing that sleep apnea is present can be a very serious mistake. Sleep apnea already causes repeated drops in oxygen throughout the night. Adding a medication that further suppresses breathing makes those oxygen drops deeper and longer. The heart, starved of adequate oxygen during those hours, is under enormous stress. The right action here is not to avoid all sleep aids permanently without guidance. The right action is to ask a doctor specifically whether any sleep aid being taken is safe for the heart and for the lungs. That is a direct question that deserves a direct answer. And if there is any chance that sleep apnea is present, getting evaluated for it before taking any nighttime medication is critically important. This one conversation with a doctor could prevent something irreversible. The fourth mistake is ignoring nighttime symptoms, and this may be the most common mistake of all. So many people over 55 have learned to live with things that their body is clearly trying to communicate. They hear themselves snoring and think nothing of it. They wake up with a headache and assume it will pass. They notice that their heart feels like it is racing or fluttering at night and tell themselves it is just anxiety. They wake up drenched in sweat and blame the room temperature. They feel crushing fatigue every single morning and conclude that this is simply what being older feels like. But these are not random inconveniences. Each one of these symptoms can be a signal from the cardiovascular system that something is wrong. Sleep apnea is the condition that links almost all of these symptoms together. It is a condition where the airway partially or fully collapses during sleep, causing the body to briefly stop breathing. This happens not once or twice a night, but potentially dozens or even hundreds of times. Each time the breathing stops, the oxygen level in the blood drops. Each time the oxygen drops, the heart is forced to work harder to compensate. It beats faster, blood pressure spikes momentarily, the stress hormones surge, and then the cycle starts again a few minutes later. Over months and years, this repeated strain on the heart dramatically increases the risk of heart attack, stroke, and sudden death during sleep. The frightening thing about sleep apnea is that people do not feel it happening. They do not wake up fully aware during most of these episodes. They simply feel tired. They notice the symptoms listed here and normalize them. And meanwhile, the damage accumulates quietly. Dr. Monroe has reviewed cases where sleep apnea went undiagnosed for 5 to 10 years, and by the time it was identified, the cardiovascular damage was already significant. The message is simple. These symptoms are not normal signs of aging. They are red flags. They deserve medical evaluation. And catching sleep apnea early is one of the most powerful things a person over 55 can do to protect the heart. The fifth mistake is going to bed with stress still active in the body. This is a mistake that most people do not even recognize as a heart issue at all. They think of stress as something that belongs to the daytime, something that happens at work, in traffic, during difficult conversations. They believe that once they lie down and close their eyes, the stress is over. But the body does not work that way. When the mind has been under stress during the day, and especially when stress is not actively released before bed, the hormones associated with stress remain elevated well into the night. These hormones are cortisol and adrenaline. Both of them are designed to put the body on alert. They raise the heart rate. They raise the blood pressure. They keep the muscles slightly tensed. They keep the brain partially active. When these hormones are still circulating at high levels during sleep, the heart never fully gets to rest. Instead of blood pressure dropping naturally to its lower nighttime level, it stays elevated. Instead of the heart rate slowing and settling, it remains higher than it should be through the night. The heart is essentially working overtime during hours when it is supposed to be recovering. The long-term consequence of this is serious. A heart that never fully rests during the night accumulates strain over time. Blood pressure that stays high through the night damages the walls of the arteries gradually, and the risk of an early morning heart attack or a dangerous heart rhythm problem increases substantially. Most cardiac events happen in the early morning hours, between 4 and 8 in the morning. This is precisely because that is when the body is transitioning from a night of insufficient rest, and the cardiovascular system is most vulnerable after hours of unresolved stress. The solution to this is a consistent calming routine before bed. This routine does not need to be long or complicated. 20 minutes is enough. The goal is to give the nervous system a clear signal that the day is over, and it is time for the body to shift from a state of alertness into a state of recovery. Dimming the lights in the room helps because bright light keeps the brain in a daytime mode. Slow, deliberate breathing for a few minutes lowers cortisol noticeably. Gentle stretching releases the physical tension that stress stores in the muscles. Quiet time spent in prayer, meditation, or simply sitting in stillness tells the brain that there is no more danger to respond to. These simple acts, practiced consistently, make a measurable difference in nighttime heart health. Now, stepping back and seeing all 5 of these mistakes together reveals something important. None of them seems catastrophic on its own. Going to bed a little thirsty, lying flat, taking a common sleep aid, brushing off a snore, carrying some leftover stress to bed. Each one standing alone seems like a minor issue, but the heart does not experience them as separate minor events. The heart experiences all of them together in the same night, over and over again. And that combination creates what Dr. Monroe calls nighttime cardiac strain, a slow, invisible accumulation of stress on the most vital muscle in the body. Over months and years, that strain takes a toll. The arteries become stiffer, the heart rhythm becomes less regular, the blood pressure stays higher even during the day. And one night, when all 5 of these stressors align at exactly the wrong moment, the heart simply cannot handle it. That is not a dramatic story. That is the medical reality of what happens when nighttime heart health is ignored for too long. And the reason Dr. Monroe is so passionate about sharing this information is because it is preventable. Almost entirely preventable, with simple changes that cost nothing. So what does a heart-safe bedtime routine actually look like? It starts in the early evening. About 60 to 90 minutes before bed, drink a small half glass of water. Not a full glass, just enough to ensure the blood is not thickening overnight. Then begin dimming the lights in the living space. Bright screens and overhead lighting keep the body in a state of wakefulness longer than most people realize. Begin slowing down. If stretching feels good, do a few gentle movements to release tension from the back, the neck, and the legs. Take a few slow, deliberate breaths. Not forced breathing, just intentional, slow, gentle breaths that signal to the nervous system that everything is calm and safe. When it is time to get into bed, adjust the sleeping position. Add a wedge pillow or extra support under the upper back and shoulders. If lying flat has been causing any discomfort, shortness of breath, or restless sleep. Even a modest elevation of the upper body, enough to raise the torso about 10 to 15 degrees, can significantly reduce the pressure around the heart and lungs during sleep. This adjustment takes less than a minute, but its effects last all night. Check in with how the body feels. If there is lingering tension in the chest, the shoulders, or the jaw, Take another slow breath and consciously release it. If any nighttime symptoms have been noticed, whether it is heavy snoring, waking up breathless, morning headaches, night sweats, or persistent exhaustion despite adequate sleep hours, make a commitment to speak with a doctor about them. Write them down if necessary. Do not dismiss them. Do not wait for them to become something more alarming before seeking an evaluation. Early detection of sleep apnea or any underlying cardiovascular issue is enormously powerful. Treatment options are available and effective, and the improvement in both sleep quality and heart health that comes with proper treatment can be life-changing. Sleep is not simply a passive state where the body shuts down and waits for morning. Sleep is one of the most active and important processes the heart goes through every single day. During sleep, the heart is supposed to rest, recover, and reset. Blood pressure is supposed to fall to healthy lower levels. The heart rate is supposed to slow and stabilize. The blood vessels are supposed to relax. All of this is the body doing exactly what it needs to do to keep the heart healthy for another day. But when the 5 mistakes described here are present, none of that recovery happens properly. The heart never gets the rest it needs. And the cost of that, paid night after night for years, eventually becomes irreversible. The man whose story was shared earlier is not unique. There are thousands of people just like him, men and women who seemed okay by most measures, who did not consider their nighttime habits to be a health issue, who thought that the tiredness was just aging, who never got the information that could have changed the outcome. That is the purpose of sharing this today, not to create fear, but to create action. Because unlike so many health problems, this one is largely within each person's own hands to address. The habits are small, the changes are simple, and the protection they offer is profound. So here is a question worth sitting with tonight. Of the 5 mistakes covered here, which one sounds the most familiar? Is it going to bed a little thirsty to avoid the bathroom? Is it sleeping completely flat and sometimes waking up short of breath? Is it taking a sleep aid without fully knowing its effect on the heart? Is it brushing aside the snoring or morning headaches that have been there for years? Or is it carrying the stress and worry of the day right into the bedroom without ever giving the nervous system a real chance to wind down? Most people who are honest with themselves will recognize at least one of these. Many will recognize more than one. Recognition is the first step, and every step taken after that, no matter how small, is a step toward a safer night and a stronger heart. Share this with someone who needs to hear it. A spouse, a sibling, a close friend. Because the most powerful thing about this information is that it is simple enough to act on today, tonight. Before going to bed, the heart works without stopping, every moment of every day and every night, without ever asking for a break. The very least it deserves is a bedtime routine that gives it the best possible chance to do that work safely, quietly, and for many more years to come.